All right, two faces that you might recognize, and if you don't, now you will. Jessica and Brian host a podcast called The Secret Life of Parkinson's. If you haven't seen it, you need to. They have over 150 recorded podcasts, so lots of good time on whatever video application you're using. Both are living with Parkinson's. Jess has had it for 6 years and Brian for 10. And they've found a niche, I think, where patients are learning from patients. So it's good to hear from doctors, of course, but when patients are able to help other patients, even better. So thank you very much, Jessica and Brian, who are here to talk about preparing for the future. Let's give them a hand.
Hello, hello. Make sure your mic's working.
I'm a quiet, shy one.
Yeah, we all know that. Hi, everybody. My name is Jessica Krauser. I have young onset Parkinson's. I'm 43 years old, and I was diagnosed when I was 37. And this is Brian Baker, if you want to introduce yourself.
Hi, Brian Baker. I've been diagnosed almost 10 years. Had DBS. It will be 3 years this summer.
What?
Yeah.
Oh, DBS. I'm
DBS, sorry.
What you said. I shouldn't be speaking for you. I'm sorry. That's one of the things we're going to talk about. But we started a nonprofit called the 5K for JK. It is not actually a 5K. Some people can make it into one, but we have our yearly event again this September. More details to come. But it is just a walk around a track. But what it turned into was a nonprofit because we realized how many people out there are like us, but they need more information, and they need information on how they can live a better life today. And so with that, we have those kits. So if you didn't see the kits, I don't know, we might have a few extra left. If not, we can order one. And then we also have the podcast, as Matthew mentioned, called The Secret Life of Parkinson's, and it's just Brian and I talking to other patients at varying stages, varying symptoms. We talk to neurologists, physical therapists, speech therapists, caregivers. Researchers. I mean, we have a lot of different people on there just to give us awareness. Melissa's been on there like 20 times. So anyway, so that's a little bit about us. But what we want to talk to you guys about today is care partner support and communication. And I'm going to take this down. Sorry. And there's two things that we want to really focus on, and one of which is communication. So with communication, you might all think, yeah, I know I should be open and with my spouse or with whoever your caregiver may be. But it really does have to go both ways. It's not the patient, it's not us always telling the caregiver or anybody else all of our problems, but it's also the caregiver being able to ask questions. So one of the things that we talk about a lot is, and what we hear a lot, is for people not to finish our sentences or speak for us. And I'll ask Brian a question in a minute, but what I prefer actually, so when people get caught up in my speech, like if I get caught up in what I'm trying to say, I actually prefer for somebody to jump in and fill in the gap. So that's why sometimes I'll look to him, I'll look to my friends or something. It's like and sometimes they'll look at me, I'm like, just say it, because I know you know what I'm talking about, but I just can't get it out. And so they will help me out. But I know that there's a lot of patients out there that do not want that help. They want to try and think of it. So caregivers, make sure you ask the question. But people living with Parkinson's, please be open and tell them if they didn't even ask. Just say, hey, I'd like to try and do this on my own. Whether it's getting up out of a chair, going on a walk, trying to get over a step, but also be mindful of what you're able to and not able to do. So what do you have a preference? Because I know I'm different.
I don't have a preference, but you've been speaking for me for 3 years, so
That's not true. Actually, it is kind of true.
It's very true.
We actually had a podcast comment. I think Tom, where's Tom? I think Tom was telling me about it. There was a podcast comment just last week of somebody said, Jessica, please let Brian talk. He has a lot of good things to say. So you do have a lot of good things to say. But for patients, it's also important, I'm sorry if I'm saying patients and you guys don't like that. There are a lot of people, this is another thing you can ask each other. What do you prefer? I don't mind being called a patient. Some people don't like that. They want to be called just a person living with Parkinson's. But anyways, so there's all kinds of things that you need to communicate about. But the other one that I was going to mention is for the person living with Parkinson's, talk to your caregiver. How are you doing with me progressing? How do you feel about having to potentially do things that we didn't expect we would do, down the road? And Brian, I know might have to have that conversation with your son. My daughter's here. I've had that conversation with her, and I was like, so are you going to be okay that one day you're going to have to do my hair? She already does my makeup just because she likes doing it. But it's just things like that. You have to have those conversations.
Yeah, just checking in with them and saying, as the patient to the caregiver, how are you doing with my disease? And being open to hearing what they have to say is critical. Yeah, they're struggling right along with you. They don't have it, but they're the ones picking up everything, driving you places, cooking your meals, massaging your shoulder because you feel like it's going to fall off, like I do right now. So check in with them and say, how are you doing? Are you okay with us not traveling like we had planned all those years ago? Wait a minute, you want to travel? I can travel,
Mm-hmm.
So.
Brian, can you talk to us about how people living with Parkinson's should be open to a caregiver or a friend or somebody coming to the doctor appointments with them, and why?
So I think I just talked about this a little while ago. I had always gone for the first 9.5 years by myself. Yep, I'm doing fine. So Jessica and a friend of mine went with me last time, and the doctor said, how you doing? I said, I'm doing fine. And I saw their look on their face kind of,
I said, no, you're not.
Yeah.
You can.
Yeah, and then all of a sudden he said, how's your speech? I said, perfect. And I thought Jessica's going to come flying out of the chair. She's like, Brian, you're lying. So I guess for me, it's having that person to go with you, a friend, a coworker, somebody that's around you all the time that can be honest with you, because sometimes we don't want to be honest with ourselves and say, yes, I'm struggling with this, or I didn't realize my speech was as bad as it was.
And that's the other thing. A lot of times we don't realize what we're actually going through.
Right. So, and as the caregiver, be that advocate and have that honest conversation with the doctor while you're there. No, he's not walking okay. No, he did fall. He is struggling speaking. He's drooling, whatever. It can be that simple, but be that voice, because sometimes we're not the best patients.
Well, and oddly enough, and we heard this on one of our podcasts when we were interviewing a doctor on mental health and just the emotional things and things going on with us, but she actually talked about this, and I didn't realize that this was even an issue, but people living with Parkinson's, like Brian said, he didn't know that his speech was bad. And I'm looking at him like, how in the world do you not hear yourself? Or if people are walking super slow, or if you're moving your spoon up to your mouth, we as the person living with Parkinson's don't always even recognize what we're doing, because either we're used to it or we just, it's kind of like, I still feel like I'm in college, like I'm not 43. So you kind of go through that mindset. So I had the conversation with my husband to say, I want you to tell me what you recognize. Because most of the time, I feel like I'm pretty self-aware, but I know there's going to come a time that, I didn't know I was doing it, or didn't know it was so pronounced.
Prevalent.
Yeah. Yeah.
I'll speak for you.
Thank you. And then lastly, what we want to talk about is, again, specifically for the caregiver, but this is for the person living with Parkinson's too. Caregivers, you have to take care of yourself. For anybody who has children, you know that if you're not good as a parent, meaning you don't take care of yourself as a parent, you're going to be no good to your child. And if you're not good as a caregiver, you're not going to be good for the person that you're caring for. You have to take care of yourself. And person living with Parkinson's, you have to let them be okay with that. My husband was actually in the other session, so he did that education part, but we keep a distance sometimes about things that I'll talk about or how often I talk about it, because he wants to just, still be looking at me as just me, and just like, let's continue to live our lives and not have Parkinson's always be a part of it. And that's important from his standpoint as a caregiver of how he can best take care and support me. And so it's, again, having those conversations and knowing when and what to talk about. But person living with Parkinson's, make sure that you are allowing them that space, and it's going to be very helpful for the both of you moving on.
And for the caregiver, it's important to find a support group, for things, if they're early on, maybe things that you could be facing later on, but just having that outlet to vent sometimes, Brian's a real pain in my beep, whatever, those things are important, just having that outlet, having somebody that understands what you're going through on a day-to-day basis.
No, I think that's very true, because, it's been so powerful for us as the person with Parkinson's to find people like us. But as the caregiver, you are the same way. I want to find somebody has a spouse, has a person that they're caring for that is at the same stage even, because my husband being, younger, both of us being younger, he's not younger than me, but, we're going at this at a different stage, so he can compare, he can talk to, my young onset friends, their spouses, in a different way, or in a better way for him, because we have kids the same age. We are still both working. So everybody goes through different phases and stages of life, and it's just like any community. You got to, find the people that are best connected with you. So, I didn't ask this in the last one, but does anybody have any questions for us, or anything that we can help, or answer, or yeah? Brian's going to come down and give you the microphone.
Once again, she's talking for me.
Shut up.
Do the same thing. I'm Melinda Guzman Hardy, and my husband is Kevin Hardy, who has had Parkinson's since 2010, so it's almost 15 years. Now, his symptoms are variable, but the most critical one is really the hallucinations, dry eyes, not so much mobility or freezing, thank goodness. But my question is, he does tend to be very, very stubborn. Very, very stubborn. And, I'm only 5'3", he's 6'2", and there's no way I can physically stop him. He tends to try to be independent. What do we do when, just this morning I prepared his breakfast, and usually he has a good brunch breakfast. Well, he started walking to say goodbye to me on the door, and he was carrying his bowl of food, orange juice in one hand, and I said, "Where's your walker?" "Oh, I'm okay. But he nearly fell. In fact, I said, "See what happens. I'm not telling you that you're doing something wrong, but you cannot." And then he started, coughing because I said, "Did you even chew your food?" Because they all came out. And I said, "How do I handle this? You're right. I have to take care of my own mental health."
Yes. So I do have an answer for that. And I usually tell people, I have a podcast on that. But we actually just did recently speak with a doctor, is it a neuropsychologist, Brian? The one from Cleveland Clinic?
Yes.
Okay. And I can tell you what episode it was in just a minute, but she talked about how, I think she focused more on men, but she said people with Parkinson's, specifically men who are older, are very stubborn. Like, and so what she talks about is, you know, a lot of people will, when they hear like therapy, like talking to a therapist, they're like, oh, no, like I'm not talking to somebody else. But if you can understand what the benefits will be, either just for you to learn how to best care for somebody who is stubborn, or for the both of you so that he can then learn, you know, different ways of how to communicate. So I don't want to look on my phone just yet unless you guys give me a minute to see what episode it is. But it is one of the latest episodes we had, and it's with a doctor from Cleveland Clinic. Anybody else? Okay. All right, great. Well, I'm going to bring Matthew back up, and I think, have one more segment left, and then we're home free. Thank you, everybody.